a physical therapist with Bonsecours In Motion Therapy. I work at our Health Weight Clinic in Virginia Beach, and today we're going to be talking about an active release technique treatment, which entails working on the soft tissues of the lower extremity. So this can entail anything from knee pain, hip pain, ankle or foot pain. Today specifically we're going to be talking about two treatments for the calf musculature, and specifically the gastroc and soleus. So this can play a factor with Achilles tendonitis, any plantar fasciitis, or just limited ankle and foot range of motion. So today what we're going to do, first technique is going to be for the gastroc muscles specifically. So these are going to be the big muscles lying on top of the calf here. So if we want to work on some range of motion, what I'm going to have Calvin do here is point his foot down towards me, and you can see the heads of the gastroc outlined here. I'm going to start towards the inferior portion of the muscle belly itself. So I'm going to place tension down into the muscle and then up superiorly. Then I'm going to ask Calvin to dorsiflex his foot. And at the end of the range of motion, I'm going to give him a little assistance, and we're going to hold here. We hold for a few seconds, and then come up. So I'll work then more superiorly up towards the origin of the muscle. So he's going to point down again. I move my contact up, and same thing. Press down, move up. I can give a little bit of a block to apply more pressure. And again, working on that dorsiflexion range of motion. Now, considering where the gastrocs originate, they will actually originate above the knee. So if I want to get more towards the origination point of either heads of the gastroc, I will bend his knee to help slacken the muscle. I will help him point down, pressure down towards the muscle belly itself, tension up, and then help him extend the knee. And then again, same thing with the dorsiflexion itself. This can also play a factor with hamstring strain or knee injuries themselves as well. Good. So we can do that on either side, either the lateral head or the medial head. Next we'll do is work on the soleus muscle, so that lies beneath the gastroc. So in order to reach that, we need to make sure that these gastrocs are nice and slackened. So what I'm going to have Calvin do is stand up. From this position, we can work on the soleus. So this is the big muscle that lies beneath the two heads of the gastroc. So in this kneeling position, we will slacken the gastroc muscles to allow me to reach a deeper pressure towards the soleus muscle. So again, Calvin's going to point towards me. I will place my tension down a little bit deeper this time than I was previously. But same thing now, I will tension up, and Calvin will dorsiflex his foot, and I can give him a little assistance. Now with this soleus muscle, we can actually work down more towards the Achilles tendon itself. This muscle does not cross the knee, so we don't have to worry about going too far superiorly towards the knee joint line. But this will play a big factor as the big posture muscle remains active pretty consistently with most daily activities. So a lot of times this muscle can get tight, overactive. This is a good one to work into to help improve that ankle range of motion as well as reduce tension on the Achilles tendon itself.